But what about surgery? I've seen experts who say that that this cures ulcerative colitis.
Right. Doctors and other experts do claim that surgery is a cure for ulcerative colitis. And it, however, is really only a cure because the diseased organ itself is gone. It's kind of like curing a leg infection by chopping off the leg, amputating it. Yeah, you don't have an infected leg if you don't have a leg. While studies indicate that most patients are actually generally happy within a few years after having had the surgery, not, mind you, not in the first year or two afterwards. I'm sure that's because most of these patients are just trying to make the best out of their circumstances and would have preferred still having their colon intact and being healthy if they had known that was an option. And the problem is they just don't believe that's possible. And so when considering fecal transplants, I also weighed the options of having surgery. And effects from the surgery include dietary restrictions and wearing a bag on the outside of your body that you have to empty 5 to 6 times a day. And if you have a surgically created J-pouch, which is a substitute large intestine made out of part of the small intestine, then you still need to go to the bathroom 5 to 6 times a day for the rest of your life and face significant risk of the J-pouch getting infected. So 5 to 6 times a day for the rest of your life if everything goes well. And I think when honestly considering all these factors and knowing that fecal transplants could help you prevent surgery, I think almost anyone would have done the same thing I did if they were in my situation, knowing what